Hi, I'm Dr. Michael Taggart with Lake Washington Chiropractic. I'm a board-certified chiropractic physician with 18 years clinical experience. I have advanced training in neurology, spinal rehabilitation, and nutritional therapies. I want to welcome you to our Fibromyalgia, Chronic Pain, and Chronic Fatigue Recovery Program DVD, where we explain how we treat patients both neurologically and metabolically. So we put this DVD together to really help give you hope that no matter how bad your condition is, no matter how many doctors you've seen without success, that if you do our neurologic and metabolic treatments and therapies, that you can get better. Now, the information I'll be sharing with you, 99% of it you've never heard before. It's somewhat technical in nature, so I'm going to do my very best to make the concept as simple as possible so you can follow along with the discussion. You may find that you need to watch this DVD more than once to fully understand what I'm discussing here today. There's a website that I want to bring your attention to. It's called LifeChangingCarecom. And on this website, there are over 843 testimonies of patients that have been evaluated and treated both metabolically and neurologically with all kinds of conditions like fibromyalgia, chronic pain, migraine headaches, multiple sclerosis, peripheral neuropathy. And I'd like you to go to this website and click on the condition that most closely resembles what's happening with you and listen to some of these stories. There's amazing stories on this website. Many of these patients have been told by maybe more than one doctor that there was nothing more medically that could be done to help their condition, and they were told they were just going to have to take these medications for the rest of their life and they would learn to live with it. So by going to this website and reading some of the success stories, that's going to help give you some confidence that if you follow what I'm going to be recommending, that you can get better just like these people did too. Now, what makes our office different? Why am I going to be the doctor that finally helps you when maybe you've been to 2, 3, 4, maybe even 15 other doctors that you've not gotten help from? Well, one of the things that's going to be different is that we are not going to treat your label. Typically, people have been to a doctor where they were given a diagnosis or a label and they tried to treat that label, typically with medications, which usually doesn't work. So what we're going to do is we're going to do something completely different than that. We're going to treat you as an individual, and we're going to run some very specific tests to find out what in your body is not working. And if we can find out what in your body is not working and both address that neurologically and metabolically, we have an excellent chance to help you get better. Now, you're watching this DVD today because you've been told or you think you may have fibromyalgia, chronic pain syndrome, and or chronic fatigue. Now, when you have fibromyalgia, you typically have a whole body pain. Your pain may be worse one day, let's say in your low back, and then it may be shift and it's worse in your neck. There are also a specific number of tender points in the body that when they're pushed on make the pain worse. There are some doctors that believe those points aren't necessary for the diagnosis. So whether you truly have fibromyalgia or a chronic pain syndrome, you really don't care. You just want to find a doctor who can find out what's causing your chronic pain and help you get rid of it so you can get your life back. Now, as far as chronic fatigue goes, to have the designation of chronic fatigue, you have to have this fatigue for 6 months, and you typically have flu-like symptoms where you feel like you have like symptoms of a viral infection, where you have, of course, fatigue, and you have muscle aches and pains, and you have flu-like symptoms. Now, many people who have fibromyalgia and or chronic pain because it interrupts their sleep often end up with chronic fatigue. So when you come into our office, we're going to do a series of tests. Some of these tests maybe you have had and some of them you haven't had. So it's our pledge to you that we will leave no stone unturned to find out what is the cause and or causes of your chronic condition. So we're going to order some specific blood tests. We're going to order a very comprehensive thyroid panel. We're going to do what's called a complete metabolic panel on you. And we'll also check your lipids, like your triglycerides and your cholesterol. And we'll also check your right and white blood cells. Now, it's very common for patients to come to my office to say, well, doctor, I've already had all these tests and they came back quote unquote normal. So it's very important that we discuss this concept. I want you to know that there's a difference between lab normal and what we call the functional range. Lab normals are based on the averages of people who are very ill. The data that lab normals comes from is for people who are visiting medical clinics. They have conditions often debilitating, they may be on oxygen. So the data that we get to create a bell-shaped curve often is going to miss people on the low end and the high end. These people typically have obvious symptoms of organ problem, but because the data is skewed towards the sickest patients, often those patients are missed. For instance, a person may have obvious thyroid symptoms. They may have cold hands and cold feet, gain weight easily, can't lose weight, and they have fatigue. The laboratory normal for thyroid for what's called TSH is 0.5 to 5.0. That's a way too broad a range. So people can go to these doctors and have these tests done and it shows that they're normal, but yet they're having obvious symptoms. So a better range is what's called the functional range. The functional range comes from data of healthy people who don't have disease, they have health, and this is the range that we want to use because we want to get you in the healthy range. We don't want to get you just barely out of the disease range. Like for instance, the functional range for thyroid TSH is 1.8 to 3.8, so that's a much tighter range. So we're going to find these people who are on the low and high end of the laboratory range, and we're going to find out what's not going right with that thyroid gland. We're going to have very effective therapies to help those people. So a lot of people who are having laboratory normals, a lot of those problems are being missed, and so it's very important that we do a very thorough blood chemistry analysis because we can find things that are being missed. We find things that are missed every day in our office. Now, as we check your white and red blood cells, we are going to look at your immune system. Your white blood cells may give us an indication if you have a chronic infection that hasn't been found. As we look at your red blood cells, that's going to let us know if there's any anemia patterns that have not been found. Now, anemia is a very serious condition because your red blood cells take oxygen to your cells. So if you have a lack of or anemia situation, you're not getting oxygen to your body, that's going to make you tired. It's very important that we discover this is happening. So we're going to assess your thyroid, your adrenal gland, at least in part, your liver, your kidneys, your red and white blood cells with the blood test that we're going to do. And by assessing that, it's going to help us find out what's going on with you. With the blood test, we'll also be able to find out what's going on with your upper gut. Lots of people have hydrochloric acid deficiency, which is going to impair digestion. It can cause reflux problems. It's a very common thing we see in our office. And we do all these tests to really get you better faster. And that's what you want. You want to get better as fast as you can, and we want to have rapid results in our office. With the comprehensive metabolic profile, we'll also look very importantly at your glucose level. Glucose is one of the things that all your cells in your brain need for fuel. So if we have a low blood sugar situation or a high blood sugar situation, that's an impaired brain function. It's also going to be toxic to the nerves. The functional range for blood glucose is between 85 and 100. Now, if you come back with an 82, that tells me that you have a functional hypoglycemia syndrome going on. The symptoms of that, most common symptoms would be shaky or irritable if you miss a meal, crave sweets, and you immediately feel better after you eat. If you have a blood chemistry over 100, that tells me that you have what we call insulin resistance. Insulin resistance occurs when your body becomes desensitized to the insulin that your pancreas is making. So if your cells aren't responding to your insulin, you can't get any sugar into your cells, so that blood sugar is going to raise. Symptoms of insulin resistance, which is kind of a pre-diabetes syndrome, are craving sweets in between meals, and you also feel very tired after you eat. So in a medical practice, if you came back with, like, say, 100, 102, they would say, well, it's not diabetes yet, let's just watch that. And we'll wait until it gets to the point where you have a diabetes, and then we'll put you on a medication. So does it make sense that you should wait until it gets that bad that you would be put on medication, or it would be better to treat it now to get you back to health? The next test that we're going to do is what's called food allergy testing. It's very common for people to have undetected food allergies. Some symptoms of food allergies are chronic pain and fatigue. So when you have these food allergies, it creates inflammation. That's going to irritate nerve endings. You're going to get chronic pain, and it's also going to make you tired. It also can affect the digestive system, which can make your bowels not move enough or move too much. It also can cause other digestive problems, can cause, make you feel bloated after you eat. It's a very common symptom. You may feel sick after you eat. It can also cause sores in your mouth. So when we do food allergy testing, we're going to look for the main food allergies. The most common are going to be gluten, which comes from wheat, rye, oats, and barley, milk, eggs, yeast, and soy. Now when we do these tests, we're going to not only determine if you have a sensitivity, which with proper care you probably can overcome, but we're also going to find out if you have a genetic issue where your body does not make the proper enzymes to actually break down these products. If we find that you have an immune, if you have a genetic problem, then these foods may be something you're probably going to have to avoid your entire life, because your body just doesn't produce the necessary components to actually break down those foods. Gluten sensitivity is a huge problem in our society. More and more people are having problems with it, and it's very important to determine if you have any type of food allergy, because it's definitely going to make your condition worse. The next test that we're going to do is what's called the Adrenal Stress Index. And this is a test that's not a blood-based test, it's a saliva-based test. Just like people that are in the criminal justice system use swabs of saliva and tissue to determine what's going on with your DNA. The saliva test is the most accurate way to determine what's going on with your adrenal gland. Your adrenal gland secretes two important hormones. One is called cortisol, and cortisol is a stress hormone, and it's a good thing that your body makes that in a short period, for the short term. If your body makes too much cortisol long term, that's not a good thing. It will cause your immune system to drop. It will also affect certain areas of the brain that will cause you to lose your short-term memory. Many fibromyalgia patients who come to me say that their short-term memory is very poor. Have you ever walked into a room and forgot why you walked into the room? Have you ever been talking to somebody on the phone or called somebody up and can't remember who you called? Are you having difficulty remembering names and phone numbers? Those are signs that you're losing your short-term memory. Now with cortisol, there's a certain rhythm that occurs throughout the day. Your cortisol level should be fairly high in the morning because it's a stimulatory hormone, it gets you going, and then as the day goes down, it should slowly wane to the point where it's at its lowest before you go to bed. So your cortisol should be low when you go to bed so that you can relax and go to sleep. Now what happens if your cortisol is high at night? You cannot get to sleep, or you cannot stay asleep. So anyone who has insomnia issues, has trouble sleeping, this is a very important test that we do to find out if cortisol is affecting that sleep pattern. Now the other hormone that your adrenal gland makes is what's called DHEA, and DHEA is a building block that will eventually make your hormones, both male and female hormones. So anyone who has hormonal issues, whether it be male or female, we want to make sure that there's enough DHEA to make those hormones. The next test that we're going to do is we're going to do what are called immune panels. Now this concept is a little bit complicated, so you might want to take special attention to this. Now the reason that we do immune panels is we want to see how your immune system's functioning. And what we're suspicious of is that you might have an autoimmune disorder. Now the immune system, a healthy immune system, is going to attack and get rid of dying tissue or unhealthy tissue. That's normal. But if your immune system starts to attack healthy tissue, that's not normal. That's a very bad situation. So we need to do these tests to determine if that's happening. Now there's all kinds of tissues that can be attacked through autoimmune disorders. If your joints are attacked, that's called rheumatoid arthritis. If your connective tissues are attacked, that's called scleroderma or SLE. If your thyroid is being attacked, that's called Hashimoto's thyroiditis. Now there's a lot of other, and multiple sclerosis, that's an autoimmune disorder where the myelin, which is like the insulation around your nerves, is being attacked. That's called multiple sclerosis. And there's a lot of other autoimmune conditions that don't even have names for them yet, but the idea is that your body is attacking itself. That's a very bad situation to be in. So in your immune system, there are kind of like two sides of your immune system. There's what we call Th1 and Th2. Th1, those are the T cells. Th2, those are the B cells. Now both T cells and B cells are specialized white blood cells. Th1 cells kill bad things. We call that an antigen. It could be a bacteria, virus, parasite. Your body's going to try to kill that because it's not supposed to be in the body. Now sometimes these T cells can't find what to kill. Like viruses are hard for the immune system to find. So what the B cells will do is it will create an antibody to put like a marker or a tag on that bad guy so that the T cells can find it easier and kill it. So normally there's going to be a balance between T cells or Th1 and B cells or Th2. When we have a balance, we're going to have a properly functioning immune system. But what can happen sometimes because the body can't kill the bad things, these excited T cells start going after healthy tissue. Now, there are some markers that we do our immune panels that we're going to look for. TNF-alpha and interleukin-2 are markers, if they're high, that would show that the Th1 side is overstimulated or what we call dominant. It's over-dominant. When we do our immune panels, we're going to look for Th2, we're going to look at interleukin-4 and interleukin-10. Now, if these levels are high, that's going to tell us that our Th2 side is overstimulated or dominant. So when we do these tests, we'll be able to find out if your immune system is balanced or if you have a dominance. If you have a dominance, what that tells me is that you have an autoimmune disorder, and this is the most, if you have this is the most important thing that we must address, because if we don't, you will not get better. Now, once we determine that you have a dominance, we have to find out what is causing that dominance. It could be a parasite, a virus, a bacteria, a heavy metal, or a food sensitivity that your body is not able to deal with properly. Now, if you have a Th2 dominance, it could occur because you have an anemia situation, blood sugar problem or adrenal problem. And we'll find that out from our complete metabolic profile and our adrenal ASI test. If you have an infection, we may get some clues to that when we do your white blood cell count, but sometimes these viruses and bacteria and parasites don't always show up in the blood, so we have to do some lower gut testing to determine if these infections are hanging out in the gut. And so we use a company called Metametrics, which is a stool-based test that will basically, with that sample that you provide them, will be able to determine if these infections are going on in the gut. And whether you have a lower gut problem, an adrenal problem, blood sugar, anemia, we have all natural nutritional protocols that will help balance out these problems and help get you well. The next test that we're going to do is we're going to do what's called an intestinal permeability test. And we're looking for what's called leaky gut syndrome. Now, in your intestine, you have a barrier, an immune barrier that keeps things, undigested food particles and other things that shouldn't be absorbed into the body. You can think of that barrier as a screen door. When you have a screen door, that screen door keeps out bad things like bugs and things like that, and also lets good things in like fresh air. So what can happen is due to overuse of antibiotics, parasites, or other things that damage that lining, what happens is that these tight junctions that keep the bad things away start to open up. And when they open up, undigested food particles and other things will leak into areas where they're not supposed to be, and the immune system is going to attack that. And that's going to create inflammation. Inflammation is going to create pain. It's going to create all kinds of health problems for you. So this particular test that we do, we'll find out if you have that. We'll have to address any infections that might have damaged that lining, get rid of those infections, and we're going to put you on a protocol to actually heal that lining so that these junctions that have become too wide to bring these cells healthy, create healthy cells to recreate that healthy barrier. That's a very important test that we do. The next test that we're going to do is we're going to test for neurotransmitters. Neurotransmitters are chemical substances that your body produces that allow nerves in the brain and in the periphery of the body to talk to one another. So in between every nerve there's a small, very tiny gap. And so these neurotransmitters they're made from protein, and they allow the communication from one nerve to another. So that's a very important thing to assess. Now, the only way to really assess this is through a survey. You've probably heard of things like dopamine and serotonin, GABA, acetylcholine. These are neurotransmitters, and there's no way to really test for that as far as the brain goes, because we'd have to do a spinal tap on you, and that's not something anybody wants to do. So we have to use a survey to determine if that's happening. Based on how you answer certain questions, we'll know if you tend to have a problem with lack of serotonin. Occasionally we do supplement with that. A lot of times, once we get your digestive system better and get you digesting and making enough protein to make these substances, and we get the fuel to the brain through balancing your blood sugar, a lot of these neurotransmitter issues will just handle themselves. Now, the next thing we're going to do is we're also going to look at your hormone panels. Here are some symptoms of hormone trouble: depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain, decreased physical stamina. Now, for a male, we're probably going to look for a low testosterone. For a female, we're going to look for low estrogen and or progesterone. Now, if you go through the change of life as a woman, if your backup to your hormones, which is your adrenal gland, is doing well, you'll get through that pretty easily. Because as you go through the change of life, your ovaries and your uterus aren't going to secrete as many hormones, that's how it should be. But your adrenal gland is going to be the backup to take over for what the uterus and the ovaries aren't doing anymore. So if that adrenal gland is doing well, you're going to get through the change of life pretty easy. If the adrenal gland is not doing well, you're going to have a hard time getting through the change of life. Now, both male and female, we all have the same hormones, but we just have them in different ratios. Like men are going to have more testosterone, and women are going to have more estrogen, progesterone. Now, once we balance blood sugar and we get the adrenal gland healthy, a lot of these hormonal issues will just take care of themselves. Okay, the next thing we're going to look at is overall inflammation in the body. There's two tests that we'll do. We'll do what's called homocysteine levels, and we'll also check for something called C-reactive protein. Every patient that I've had who's had chronic pain and or fibromyalgia has always had elevated inflammation in their body. Now, when we do these tests, it doesn't tell us what's causing the inflammation, but it does give us a baseline. So as the different therapies that we do, we'll be able to tell if we're on the right track. Now, the next thing I want to discuss is what we call glutathione. Glutathione is the most important antioxidant in the body. It's called the mother lode of all antioxidants, and it's something that we give to all of our blood sugar patients if they have a high blood sugar, and also all of our autoimmune patients, because it's a very powerful antioxidant that will help lower inflammation in the body. Now, the trouble with glutathione is that it cannot be taken in pill form, because if the molecule is too big, your body won't absorb it. So the only way that you can get this is through transdermal cream, which is often what we recommend, or you can actually get it by breathing it through a nebulizer. This is a very important therapy for all of our autoimmune patients, and amazing results can occur when patients get on glutathione. Okay, so what we've done is we've talked about the metabolic side of our care. And now we're going to talk about the neurological side of care. So you think of the metabolic as the right hand and the neurological as the left hand. Both of these therapies work together to get you better. So let's talk a little bit about the brain. This area here is what's called the cortex, which is your occipital lobe, your frontal lobe, temporal and parietal lobes. This area here is called the cerebellum, and this area here is the brainstem. Now, this area here is the same as this here, but it's just blown up so you can see it better. The cerebellum, it's the back part of the brain. It's the oldest part of the brain. The cerebellum controls balance, coordinated movements, and also controls the tone to the spinal muscle. So any chronic pain syndrome that involves the spine, we definitely want to look at the cerebellum. And there are ways to test that to find out what part of the cerebellum isn't working properly. Now let's talk about this area here. This is called the brainstem. Your brainstem is composed of the medulla oblongata, the pons, and the mesencephalon, or what's sometimes called the midbrain. Many of the nerves that control the body come out of this area. So if we have any problem in this area, it can affect things like your lungs, your heart, your digestive system, your urinary system. So very important part of the brain. Now, this is kind of a simplified diagram of what happens and how to explain how the brain works. So, normally what would happen is that through stimulus, your right cerebellum would be stimulated, which would fire into the opposite side of the brain, or the left brain. The left brain would be stimulated and it would fire down into the lower brainstem. Then the lower brainstem would fire into the midbrain. Now, when we have chronic pain, the midbrain is usually the area that causes all the problems. The midbrain relies on the lower brainstem to calm it down. So if we have this feedback loop going on, the brain is going to be balanced, you're going to have good neurological health. Now, due to some type of stress, it could be physical stress. It's very common in our histories that we take with our patients. Patients tell me, well, I got fibromyalgia a couple years after an accident, especially a car accident, blow to the head. So physical stresses, emotional stresses, and or chemical stresses, what happens is that one side of the cerebellum, we'll say, in this case, the right cerebellum, does not get the stimulus it needs. And so it does not fire strongly into the left brain. The left brain does not send proper stimulation to the lower brainstem, so the lower brainstem cannot calm the midbrain down. And as a result of that, this midbrain becomes overactive and it creates all kinds of health problems. Okay, so let's talk about some of the problems that can occur from the overactive midbrain, or what we call mesencephalon. Chronic pain, chronic fatigue. Now, this midbrain is going to send stimulus to your adrenal gland. So if it's overactive, your adrenal gland is going to become overactive. Your adrenal gland is going to secrete substances called catecholamines, which is norepinephrine and epinephrine. And when these levels get too high in the bloodstream, there's certain fibers that are pain fibers in the body that are going to be stimulated based on this high catecholamine levels, and that's going to create pain. That's what creates the whole body pain of fibromyalgia. Now, when you have chronic pain, your adrenal gland is going to be, as I said, overstimulated, and it's also going to affect your sleep center. Your sleep center, which is called the reticular activating system, is in that midbrain area. And if that midbrain area is overactive, your internal clock of when you should be awake and asleep is going to be upset. And that's going to not allow you to get to sleep, and if you're in pain all the time, you probably can't get comfortable sleeping anyway, so it's going to eventually lead to chronic fatigue. Now, migraine headaches are also going to be related to that overfiring midbrain. The overfiring midbrain is going to affect blood vessels in the brain, and when these blood vessels dilate and rapidly constrict, it's going to irritate the nerve mesh that goes around the lining of the brain, and that's going to set off pain fibers, and that's going to give you migraine headaches. The third cranial nerve comes out of the mesencephalon. That's going to open your pupil too wide. That's going to give you light sensitivity. It can also affect your vision. It's going to increase sweating. People will come in and they say that their palms are they overperspire and their palms are always sweaty. That's called hyperhidrosis. It's going to affect the heart. It can cause the heart to beat too fast, or it can cause like a pounding heart. Because these nerves out of the midbrain affect the gut, it's going to create irritable bowel syndrome. It's also going to affect your urinary activity. It's going to set up a situation where you may develop chronic urinary infections, because if your bladder isn't voiding properly, there's going to be stasis of urine in the bladder, and that's going to attract infection. Also going to make your blood pressure go up, and can also give you symptoms like you have what they call fibro fog or flu-like symptoms. So, with our neurological-based treatment, we're going to do specific neurological tests to determine what parts of the brain are under firing. And then we're going to do therapies to get those areas of the brain firing properly. So your brain and your nerve system need two things to survive. They need fuel and they need activation. Fuel comes in the form of glucose. That's going to come from your digestive system. And it's also going to come from oxygen. Now, what's interesting about oxygen is the older you get, you actually lose the ability to metabolize oxygen. You become less efficient as you get older. So one of the neurological therapies that we do in our office is we put patients on oxygen to supplement. Your cerebellum, which is that very important part of the lower part of the brain, it needs more oxygen than your heart. So supplemental oxygen can be very helpful. We have patients exercise when they're on oxygen. When you move your arms, it fires very powerfully into the brain, and when you get the extra oxygen, it's going to help those nerve cells, those neurons function better. Now, some other therapies that we're going to use, and all these therapies that we do, there's a name that we call it. It's called brain-based therapy. So some of the other brain-based therapies, other than oxygen that we use, is we also use vibration therapy. When you put something that vibrates close up to your cerebellum, like the top of the shoulder, it fires very strongly into the cerebellum. So if we get that weak cerebellum firing better, it's going to help balance out that whole brain. Now remember, the cerebellum is very important for the tone of the spinal muscle, so any chronic pain syndrome that involves spinal pain is very important that we get the cerebellum functioning in an optimal way. Other therapies that we do, auditory therapy. We have patients listen to music just in one side of their ear. Visual therapy is very powerful for improving brain function. We may have people smell things in one nostril. We also may use warm water and put it up against where the eardrum is, and there's nerves behind the eardrum, and we put warm water in the ear. It's called a caloric. What it will do is it will fire very powerfully into the cerebellum, and it will help balance out the brain. We also may use non-surgical spinal decompression, which is a special table that we put patients on, and what it does is it rhythmically stretches the joints of the spine. We can use it for the low back or the neck, and this is also something that's very good if people come into our office who have stenosis, disc bulges, or herniated discs. So once we run all the necessary tests that we do, both neurologically and metabolically, we're going to be able to successfully treat you with our all-natural neurologic and metabolic therapies. Now, if you are serious about getting better, I want you to ask yourself the following questions. How has your condition affected your job? How has it affected your relationships? How has it affected your finances, your family? If you are a parent, can you play with your kids? If you're a grandparent, can you play with your grandchildren? Now, next question. What has this cost you in time, money, happiness, and lack of sleep? And where do you picture yourself in the next 1 to 3 years if your condition is not taken care of soon? Now you may say, well, my condition is so bad, how much worse can it get? Well, you probably said that 3 years ago. Now, statistically speaking, the average person is going to live to about age 75, 77. That's about 28,000 days of life. Now, if you're 50, you've only got 9,000 days left. So how do you want to live those 9,000 days? Do you want to continue to be debilitated, being a burden to your family, or do you want to be an active person that people enjoy being around? I can't answer these questions for you, but I can tell you what we can do to help your condition. What would it be worth to you if we can improve your condition? Now, it's important to understand that insurance is not going to pay for all of the care that we provide in our office. We're not doing the same care that the doctors that you went to who were fully covered on insurance are doing. This is not status quo care. This is life-changing care that we're doing. So I don't want you to consult my office expecting your insurance company to pay everything, because it's not going to do that. So if you're serious about discovering what we can do to help you, what I want you to do is I want you to call my office. Give us a call at 425-821-1101 and tell our front desk that you're interested in setting up a consultation and a case review with me. Now, in that consultation, we're going to review your health history. We're going to do a very extensive examination. That examination is going to take over 1 hour to do. We're going to review some paperwork that you'll be filling out to get an idea of what's going on with you metabolically. For that very extensive review of your examination, that fee that we charge is normally $450. Now, because you've watched this DVD, we're going to give you an opportunity to have all that same testing done and with my time, and that same examination for just $120. But you must call and schedule and have that exam done within the next 2 weeks. Now, if you choose not to come in with 2 weeks, you're still welcome to come in, but the fee will be $450. Now, I only want you to consult my office if you are serious and very motivated about getting better. So if you really want to get better, I want you to take advantage of this offer. I want to help you change your life, but you're going to have to want it more than anything. We've discussed how we treat our patients both neurologically and metabolically. You've been to doctors who have basically just treated your diagnosis. It hasn't worked at all. We're not going to do that. Our care is completely different than that. We're going to treat you as an individual, and that's why our care is so effective, and that's how it's going to help you. So I would encourage you to give our office a call. I appreciate you watching our DVD, and I really look forward to meeting with you and discussing your health concerns.